Let me start with a question. When was the last time you opened a health app and felt, wow, this was clearly built for a woman's body? If you're still thinking, you're not alone. For decades, women's bodies were labeled a medical niche, even though women make most health decisions worldwide. Here's the good news. That mindset is cracking. A wave of innovation, often called FemTech, is stepping in with smart diagnostics, wearables, and virtual specialists that put care in our pockets instead of a far-off clinic. First, let's talk about access, where and when care happens. Picture a 28-year-old teacher in a rural town. She used to burn 2 unpaid days just to see a gynecologist. Now she logs symptoms in an app during lunch, jumps on a 10-minute video call after school, and tweaks treatment before the next bell rings. That's a time zone shift in care. Or the 46-year-old executive who wakes up nightly with heart flutters and brain fog. A simple ring streams continuous data. One brief televisit sorts out anxiety versus early perimenopause, and her plan changes in days, not years. Teens, meanwhile, are quietly recording cramps and mood swings. Their phones turn those diary entries into patterns clinicians can finally act on. The lag between "something feels off" and "here's the plan" is shrinking measurably. Second, let's look at participation. Who gets to be part of care? A factory worker on the night shift messages a pelvic pain coach during breaks instead of waiting months for a specialist. A woman in her 60s worries about new bleeding. A moderated online clinic triages her questions within hours. Community health workers in low-resource settings pilot phone-based pelvic exams and pregnancy monitoring, catching red flags early. Even insurers and employers are testing benefits that weave these tools into everyday life. Now, you might be wondering, what conditions are seeing the biggest jump? Here are 3 quick snapshots. No more than 3, I promise. 1. Chronic pelvic pain. A London physiotherapist runs a hybrid clinic. Patients arrive with months of body map data on their phone. She layers in a digital pelvic floor assessment and supervises home exercises through short video check-ins. One 34-year-old retail worker goes from rotating emergency room visits to standing all day without spasms. 2. Cervical cancer screening. In South Korea, women order at-home HPV self-swab kits through a secure app. Results flow to a dashboard. High-risk findings trigger a fast follow-up. Privacy stays intact, and precancerous changes are caught before they escalate. 3. Fertility support. In Brazil, an IVF medication tracking platform syncs with the clinic. Automated checks cut missed injections. Side effect logs let nurses adjust doses between visits. Data from thousands of similar cases fine-tunes the protocol, boosting success in round 2 without extra clinic days. Take a breath. Let that sink in for a second. Third, what about later life, the years often ignored? A 59-year-old nurse in Kenya enrolls in a menopause program through her union. She connects a low-cost blood pressure cuff, completes weekly mental health check-ins, and the system flags rising cardiovascular risk plus escalating insomnia. Instead of chalking it up to stress, her team screens for sleep apnea, adjusts therapy, and links her to a peer group that meets online after evening shifts. That's holistic, age-inclusive care. Behind every story sits a quieter revolution: gender-specific data at scale. Patterns of autoimmune flares across menstrual cycles, bone density shifts after chemotherapy, even how women metabolize cardiac drugs. These clues finally surface when the right tech listens. Example time. A midwife in Lagos monitors pregnancies across sprawling neighborhoods. Blood pressure readings and fetal movement notes stream in via shared community phones. 3 women on the same block show similar warning signs. A mobile team arrives before things spiral. Meanwhile, in Toronto, a researcher studies de-identified cycle data from millions of users to see how air pollution influences cramps and migraines. The findings shape urban planning policies, not just prescriptions. And an employer in Madrid rolls out a benefits package: confidential contraceptive counseling, culturally attuned doulas, anemia screening after heavy bleeding reports, all without an awkward chat with HR. The takeaway? When women's health data connect, Single encounters become system upgrades. Now, a quick reality check. For everyday users, this means earlier answers on heavy bleeding, smarter fertility plans, and menopause care that treats sleep, mood, and heart health as one package. For clinicians and researchers, richer data close decades-old evidence gaps. For health systems, it's a stress test on privacy, proof of benefit, and fair access, so rural women, older women, and trans or non-binary people aren't left out. Ask yourself, which of your questions still have no clear place to go? FemTech isn't a side project. It's a scientific frontier repairing blind spots that left generations of women understudied. Staying curious can be simple. Ask your clinician how they keep up with new evidence, skim a journal like JMIR now and then, or check how your favorite app uses your data. Before we wrap, here are 3 reflection prompts. Feel free to pause after each one. 1. If you could grab one new data point about your own body, cycle patterns, pelvic floor status, perimenopause clues, cardiovascular risk, which would change your life the most? And what test, app, or device could you try today? 2. Think about the women in today's stories who fought to be believed. When was the last time you minimized your own symptoms? What's one clear sentence you can practice for your next clinic visit that says, "Here's what I'm feeling, and here's what I need checked"? 3. Which frontier innovation, at-home diagnostics, virtual menopause care, condition-specific platforms for endometriosis or PCOS feels most relevant right now? What's one concrete step you can take today to see if it fits your life? Let's land this plane. So here's what we covered today. Access is shifting. Care now happens on your schedule, not the clinic's. Participation is widening. Factory workers, teens, and women in their 60s all get a seat at the table. Data is scaling. Millions of gender-specific data points are finally shaping research, policy, and everyday treatment. Innovation spans life stages, from chronic pelvic pain to cervical cancer screening, IVF support, and menopause care. The big picture? FemTech isn't just gadgets, it's a course correction for medicine itself. If you remember one thing, remember this. The more women's experiences shape the data, the faster invisible problems become solvable ones. And that means the next decade of healthcare could feel a lot less like guesswork, and a lot more like care that truly sees you. Thanks for listening. I'll catch you next week, with more stories, more science, and as always, practical ways to own your health journey. Until then, stay curious and take good care.